How cancer develop. Let's go deeper into how cancer develops, explained in an informative style step by step, almost like a clear lecture or article. 1. Normal cell growth versus cancer cell growth. Every cell in our body follows a life cycle. It grows, divides, and eventually dies to make room for new cells. This process is tightly controlled by our DNA. Cancer begins when this control system breaks. Instead of dying when they should, abnormal cells keep dividing, leading to a buildup of defective cells. These cells no longer behave like normal, healthy ones and start to form a mass of tissue, known as a tumor. 2. DNA mutations, the starting point. At the root of cancer is damage to DNA, the instruction manual of the cell. DNA mutations can be inherited, caused by environmental exposures like smoking, pollution, or UV radiation, or occur randomly during cell division. Some genes are especially important in cancer development. Oncogenes. When activated, they push cells to grow uncontrollably. Tumor suppressor genes. When damaged, they lose their ability to stop abnormal growth. DNA repair genes. When faulty, they fail to correct mistakes in DNA, allowing mutations to accumulate. 3. From mutation to tumor formation. When a cell accumulates several key mutations, it stops listening to signals that regulate growth. These rogue cells divide faster than they should and begin forming clusters. At this stage, the tumor may be benign, non-cancerous, not spreading, or malignant, cancerous with potential to invade nearby tissues. The difference lies in the tumor's behavior. Malignant cells can spread, while benign ones typically stay localized. 4. Angiogenesis. Feeding the cancer. For tumors to grow beyond a tiny size, they need nutrients and oxygen. Cancer cells solve this problem by releasing signals that encourage the growth of new blood vessels, a process called angiogenesis. These new vessels feed the tumor, allowing it to grow larger and more aggressive. This stage is often a turning point where the cancer gains the ability to spread and cause more harm to the body. 5. Metastasis. Cancers spread. One of the most dangerous features of cancer is metastasis, the ability to spread from its original site to their organs. Cancer cells break away, travel through the bloodstream or lymphatic system, and settle in new places like the liver, lungs, bones, or brain. Once there, they grow into new tumors. This spreading makes cancer much harder to treat because instead of being one tumor in one location, it becomes a system-wide disease. 6. The immune system and cancer. Normally, our immune system can recognize and destroy abnormal cells before they become a problem. However, cancer cells often evolve ways to avoid detection. They may disguise themselves, produce chemicals that suppress immune responses, or create a shielded environment around the tumor. This is why some cancers can grow quietly for years. Modern treatments like immunotherapy work by waking up the immune system and teaching it to recognize and attack cancer cells again. 7. Prevention and control. While not all cancers can be prevented, many risk factors are within our control. Avoiding smoking, limiting alcohol, maintaining a healthy diet, exercising, protecting skin from harmful sun exposure, and getting regular medical checkups all help reduce risk. Screenings such as Pap tests, mammograms, and colonoscopies can detect cancer early when treatment is most effective. Treatments today range from surgery and chemotherapy to newer options like targeted therapies and immunotherapies, offering patients more personalized and effective care than ever before. In summary, cancer develops when DNA mutations disrupt normal cell control, leading to uncontrolled growth, tumor formation, and sometimes spread to other organs. Understanding these steps not only explains the disease but also highlights why prevention, early detection, and modern treatments are so important.